willing to be involved in this. It's really important that we all are able to sit down around our computers around the world and discuss this kind of thing. And then great thanks obviously to TyTek and the Jesse Lewis Choose Love movement for organizing this for all of us. I think something that Ryan mentioned that is really, really important is that concept of first responders and immediate responders. So we hear a lot, particularly in the news these days with what's going on about first responders and how important they are to our society and what they do. I think it's also important to remember that concept of immediate responders because no matter what the traumatic incident is that we're talking about, the first people on that scene are going to be the people who were there when it occurred. So whether we're talking about a mass shooting or we're talking about a natural disaster or a car accident, whoever is there when it occurs, they're the immediate responders. And the better trained they are, the more capable they are of handling it, the better off the unfortunate victims and patients of that incident are going to be. So I think with that, I would use that concept to push to all of you the idea that take a course. Right? There are plenty of courses out there under the banner of Stop the Bleed now. Most of them are low or most of them are no cost through your, there's a number of ways to find them through the trauma services of your local hospital would be one way. But take that kind of course. That said, we're going to go over some of the really basic parts of it. Being good at this requires some training, some practice, some hands-on stuff, which obviously we can't do over the internet. But we're going to go over some of the basics. And I want to push to you that if the only thing you've gotten are these very basic pieces that we're going to talk about today, and then you have the unfortunate situation of being in a place where you could use those between now and whenever you're able to get the hands-on part, go ahead and use them. Right? There's very little that someone can do that actually is going to do harm to either the victim or themselves if they follow some of the basic concepts that we're going to talk about as we go through this. And one of the first basics, obviously, is the same with other things like CPR. Right? It's still very, very important that people remember that not all the bad things that we have to deal with in society are related to trauma. There's still cardiac arrest out there, so getting basic CPR training is still important. So with those and with these kind of things, protecting yourself, wearing gloves, a simple pair of exam gloves are inexpensive and pretty much easy to hide in a wallet, a purse, a pocket, pretty much anywhere. Have those with you to protect yourself. That's really the only way that someone could get very significantly harmed out of this. So we're going to go through some of the fundamental knowledge that you need to have to be responsible. Just to be a responsible citizen of the world these days is worthwhile to have this kind of knowledge. And some of that fundamental, it sticks with you. It's like riding a bicycle once you get used to it. And then the other part is some fundamental equipment, right? There are ways to improvise most of the things we're going to talk about, but to be efficient, to be effective, it's worthwhile to have some of these tools at your disposal, right? Gloves, there's no great way to improvise a set of gloves. You could possibly use another kind of glove, but there's no way to really improvise that. So that's a big part of it. Other things like tourniquets, things like that, you can certainly improvise those, and those are effective. They're just not as fast. They just take longer, and you really have to remember how to use them. Someone who doesn't practice that regularly is going to have a harder time doing an improvised tourniquet than they will doing some form of a commercially available tourniquet. So that's a piece of it. Some form of a pressure packing, a packing gauze of sorts. So we'll show you some examples of that. Something to keep that pressure inside. So once you've built that pressure up with the packing gauze, something to put on that like a pressure dressing. So we're going to show you pieces of those kind of things and how to apply those shortly. So in the immediate response phase, whether you have these tools or not, the real name of the game here is pressure. Bleeding is controlled by pressure. Now, it doesn't take a lot of pressure. If you just have the blood vessel, it's really no harder to compress the blood vessel and stop the bleeding than it is to compress a straw on a table. The problem is sometimes that blood vessel isn't right on the surface. There may be a lot of tissue between you and the blood vessel. So we typically teach people to use quite a bit of pressure, basically whatever pressure you can safely apply to the area where you see the blood. Find where the blood's coming from and apply direct pressure well aimed at that spot. That's the answer. Now, a lot of times, though, when you have multiple people who need help or multiple injuries that need to be dealt with or need to move the patient around, that's not the most efficient way of dealing with it, though it is quick. So you need to have some other tools. And we tend to break the body out into 3 different areas of bleeding, and you see those on your screen there. We talk about limb bleeding, the arms, the legs. We talk about junctional bleeding, the places that the arms and the legs and the head sort of tie into the body, so your neck, your underarms, the groin area. And then we talk about the torso. And in each of those, we talk about different ways to manage taking care of that bleeding. Well, we're gonna try and be a little bit crafty here, and I'm gonna step out of the camera, and I'm gonna put my colleague that you saw a minute ago, Ryan Burke, here on my camera, so you can keep hearing me, but be able to take a look at some demonstration that he's gonna do as I keep talking about how we do this. I'll reintroduce you here to Ryan, and Ryan's gonna show us some of the techniques that I'm talking about here. Like a tourniquet. Tourniquets are pretty simple. Tourniquets would work on the arms and the legs. Now, tourniquets in our society have a lot of negative connotation, right? Everybody's heard that you put a tourniquet on, and that's going to be the end of that limb that you put it on. Well, that is born out of ancient history from World War I, the Civil War, where we're talking about a very different kind of tourniquet with very little training and a very different setting. With modern commercial tourniquets, following some of the basic concepts of tourniquets, these are very safe. We have good evidence that putting a tourniquet on, no real harm within about an hour or 2, which in most of our settings is going to be a safe assumption. So with tourniquets, you basically are going to put that around the limb. It forms a loop. This is a particular kind called a cat tourniquet that's commercially available. It's a windlass style tourniquet. You see the little stick there that we turn. You find the wound and you put this right above the wound. You want it a couple inches above the wound. Ryan here is simulating that maybe it's right over the wrist. If you're not sure where the bleeding is, or there's a possibility that there's other bleeding, you may consider putting the tourniquet as far up the arm as you can. Now, Ryan's not going to demonstrate that because it's harder to get on camera, but you could put it all the way up to the underarm. And we basically tighten these down as tight as they can get, and then begin turning the windlass once you have all of that Velcro applied with this particular model. Each model has its own quirks, its own specific design. The important thing is to remember that this is very effective, but it is a bit painful. So we have to recognize that going in. That works well on limbs. It doesn't work very well with your underarm or groin or your neck, because those are areas that you can't get the tourniquet around or shouldn't put the tourniquet around in the case of the neck. So when we're talking about other wounds, like Ryan is going to simulate with the limb that we have here, you would talk about packing. Now, the idea of packing is to basically produce pressure. So when I first start packing this wound with this packing gauze that Ryan's showing you there, I'm putting that first bit of gauze right where the blood's coming out, and I'm putting pressure on that, and that alone should cause the bleeding to stop. From then on, all he's trying to do as he packs more and more gauze in here is to build up the gauze to keep the pressure in place, where I put it in place with my finger at the very beginning. The idea is to get to the point where you have enough gauze in there and it's built up in every little crack and crevice to keep that pressure in place when I then move on to something like a pressure dressing. So Ryan's going to cut it a little bit short here, assuming he's got it all in there. He's now going to put 3 minutes of pressure, holding good pressure on that so that we can start to have some blood clotting. Once we've gotten through that pressure, we want some sort of pressure dressing, ideally, to hold this in place. Now, you could just continue holding it in place, but you could also just continue to hold pressure with your fingers. So we're assuming you need to be able to move on here to another patient. So we put a pressure dressing on that nice and snug. And that's how we control bleeding on the junctions or the groin, the neck, those kinds of areas. Putting something in like Ryan just simulated there with a bottle of water sort of changes the angle of your elastic bandage and gives you a little bit better pressure over what you're talking about. And that can give you some pretty significant advantages as well. So those are the 3 areas of bleeding, or the 2 areas of bleeding we talk about. When you talk about torsos, they're much more complicated. These are wounds that really need to get to a trauma center to have taken care of that way. With that, I hope that gives you some good basic information about what we're talking about here, working through some of the ways to control bleeding. Enough basic information where if you had to deal with this, I think everybody who's listened, if you're paying attention, probably could. But again, hands-on experience is really the way to go. Definitely encourage everyone to reach out, try and find that bleeding control, stop the bleed course near you to get just some extra experience with it. But the bottom line, please don't hesitate. This is something that everyone should know. And this is something that everybody should be willing to step up and use because it will save lives.